I think supplements play a small role in the overall kind of treatment algorithm for male fertility, right? It's just something that they can try to kind of optimize their reproductive health.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled, Do Male Fertility Supplements Really Work? With Dr. Kian Asanad. Justin, how are you doing, my friend?
I'm doing all right, man. We're doing all right over here. We got a big weekend of football. I'm excited for ahead of us.
Oh, man, it's can't beat the NFL playoffs, can you? I mean, neither of our teams are in there, though, so kind of sucks, but whatever.
I don't think either one of our teams will be in there for a long time. A long time.
No. We were in the playoffs. And Steelers were in the playoffs, but, you
don't have a quarterback. Exit. You don't have anything. You You haven't won a playoff game in like 10 years. Come on, let's go.
Fine. Fair enough. Anyways, this was a great episode, yeah?
Oh, this was awesome. So obviously, I think one of the big things, we had a lot of hits on our testosterone boosting supplements. So we also wanted to bring in a friend of ours and a colleague, Dr. Kian Asanad, who has really delved deep into the fertility supplement space. And this is a common question Kevin and I get a lot. And I think it was about time that we really delved deep into the data and what the data shows for supplements.
Justin's absolutely correct. The data, that's what we really looked at. You can go online and you can find anyone that kind of spouts that, hey, this supplement's going to work. This supplement's going to help you improve your fertility. But, be honest, like there's some of the stuff has no good data on it and some of the stuff has good data on whether it's effective or not. And that's what this conversation is really about.
Yeah, and we go into details a lot, but I think the bottom line is that you shouldn't be using supplements to cover true fertility issues, right? That's the big thing to take away here, is that if you have sperm count issues, you have severe sperm count issues, you're worried about that, you still need to go to a doctor and talk about it because, I think supplements, and I say this in the episode, they supplement your fertility. They add value potentially, but they are not necessarily the solution. Can they help? Yes. But are they the solution for everyone? Probably not.
Well said. So, we are joined by Dr. Kian Asanad, who is a fellowship-trained men's health urologist at Keck Medicine of USC. He specializes in andrology, male infertility, and reproductive microsurgery, and is an expert in prosthetic surgery for erectile dysfunction, complex penile reconstruction for Peyronie's disease, and minimally invasive urology. He serves as director of the USC Fertility and Men's Sexual Health Center in Beverly Hills, and is an assistant professor of clinical urology at the Keck School of Medicine. So, guys, enjoy this episode. It's fantastic. Kian's a great friend of ours, and it's a very enjoyable discussion.
All right. Let's do it. Enjoy, guys.
Listen up, guys. Your shoes say everything about you. Whether you're heading to a game, going on a date, heading to the office, or meeting up for drinks, you need footwear that turns heads and keeps you comfortable all day long. That's where Koyo comes in.
Handcrafted in Italy with premium leather, Koyo shoes are built to impress and built to last. Stylish, incredibly comfortable, and the best part, these are high-end designer shoes at a fantastic price. Casual, sleek, versatile. Koyo is the upgrade your wardrobe's been waiting for.
It's time to step up your game and get some Koyos. And right now, you can get your first pair 15% off by going to the link in our post or simply entering discount code MANUP. That's MANUP. So go visit koyo.co today and find your perfect pair. Justin, this is going to be a great episode. We are joined by our good friend, Dr. Kian Asanad. Dr. Kian Asanad is a fellowship-trained men's health urologist at Keck Medicine of USC. And, he's going to join us. We've known each other for a good amount of time, and we're going to talk about supplements for male fertility. So this is I think, really important subject to talk about. So, Dr. Asanad, thank you so much for joining us.
Thanks for having me, guys. I appreciate it.
So let's just jump straight in. Let's talk about the first question we have for you. So there are a lot of things that go into male fertility. We talk about testosterone levels, sperm development, reducing oxidative stress. So how can male fertility supplements impact, male fertility?
It's a good point. I think supplements play a small role in the overall kind of treatment algorithm for male fertility, right? It's just one little piece of the pie that, men who are having trouble conceiving or have subfertility, something that they can try to kind of optimize their reproductive health, right? It's not a magical, it's not potion, it's not something medicinal, right? It's not a prescription. So I think supplements have a few roles. They could play a role in minimizing oxidative stress. And we know that's true, right? Guys with high levels of sperm DNA damage above a certain threshold has been shown to be associated with recurrent miscarriages and IVF failure. I think fertility supplements have a role there. There's some studies that show supplements can help improve the production of sperm. More sperm improve the motility or the movement of sperm. But by and large, the supplements really kind of impact an antioxidant approach. There's very few ingredients that play a role in testosterone production, less so that have been associated with improved pregnancy outcomes.
I think that's such an important thing to highlight because I think Kevin and I'm sure you can, have also seen patients who we've actually offered other interventions, other medications, and they had decided to go the route of just supplementation. Now, obviously, I think we all are on the same page. We all offer supplements to our patients to improve fertility, with the understanding that this is it's the literal word. It's a supplement to your care. It's supplementing your fertility.
Not the magic pill, not the
Right.
one magic pill,
Understanding this idea that supplements are not replacements for fertility interventions, but they're actually just there to give us that extra boost and that extra help to improve our fertility. The question then becomes, who do you think would benefit from taking male fertility supplements?
Yeah, I think it's a little counterintuitive, right? It's not the guys who are really unhealthy, drinking daily, maybe they're overweight, they have other medical problems, they're diabetic, they're not well controlled. Those guys taking a supplement is probably not going to move the needle much, in my opinion. I think there's many other things those guys should be doing and could be doing to optimize their reproductive health, right? Like weight loss, maybe something medical to optimize their hormones could play a huge role. But I think counterintuitively, it's the guys I see that are a little, they're actually very healthy or they're pretty healthy, but maybe there's a few things in their diet and lifestyle that they still don't integrate, right? Like, so one of the ingredients, L-carnitine, which has been shown to kind of help with fertility, is predominantly a animal-based amino acid supplement. And if you're, plant-based diet, you're really not getting a lot of L-carnitine, right? And so maybe that guy could benefit from a fertility supplement, and vice versa. There's a ton of guys who are actually really healthy and taking a lot of protein, but maybe they don't have a lot of, fruits and berries in their lifestyle. Maybe they're not getting a lot of vitamin C. Maybe those guys actually benefit from some sort of supplementation. I think that's really the kind of the fine piece of it.
Keon, you made some excellent points there. And I think it was spot on in stating that, yeah, some of these guys, like if you have more, what I would say, like more bigger picture issues, such as like obesity and stuff, you're absolutely correct. This supplement is probably not the main thing to kind of try to help optimize fertility. But just because you're living a healthy lifestyle, and we've talked about in other episodes, vegan diets or plant-based diets, these are great in certain parts. They actually show benefit, but you're absolutely correct that you could be actually deficient in certain things where supplements can step in and kind of help optimize some of that void that you have.
Right.
Now, you mentioned L-carnitine.
Yeah.
Could you give the listeners just, right here at the beginning, what supplements do you recommend to men interested in improving their fertility?
Yeah, I think there's a few. Kevin, this has been studied for over 20 years now. There's been a ton of literature looking at the many different ingredients and their combinations. Some studies are really good studies, right? They're the double-blind, placebo-controlled, randomized controlled trials. looking at specific ingredients or a combination of. And there's the studies that look at a kind of retrospective, meaning like they just look at their own patients and look at their semen analysis. I think having taken a deep dive in some of this literature, I think I've come up with a few that I think has the best kind of evidence behind it, if you will. And I think that includes a list of a few different vitamins and minerals, right? Like I think vitamin A, vitamin C, vitamin E have some good data to support it. I don't think there's much data to support vitamin D or B12 or biotin. I try not to integrate those, in the mix. You can't pick everything, right? We can't just have jars and jars of supplements. Like we're
Right,
looking for
right.
something that's efficient, robust, and maybe helps get the job done, right? And I think along that goes L-carnitine. We've talked about coenzyme Q10 as it being a powerful antioxidant. So I think these are a few, and N-acetylcysteine, and now I'm actually really big in probiotics. There's been a lot of new studies and landmark papers from some of our colleagues at Cleveland Clinic that are really looking at the
Yep.
integration and the relationship between the gut health and reproductive health. And I think that's a huge area that we need to study as well.
That's fascinating. I think that that is a really interesting next step because you're right. We do know that there's a microbiota for pretty much everything now. We know in the gut, we've learned in the bladder. There's some of our colleagues have done some great research there. We're starting to learn in the testicle, in the urethra, and in the semen that
Everywhere.
there's potential predictors for other aspects. But yeah, I think that your point is great because I don't think that you should be taking everything under the sun, right? Like, because A, you don't know how they interact, and B, uh, are you really going to get a benefit of something if there is just like you just don't know what you're going to really need? So I totally agree with not just throwing shit at the wall and seeing what sticks for this one for sure. Now what obviously one thing that we have talked about, we had Dr. Gio, actually that episode came on as we're recording this, and one thing that we brought up with him, and I think that this is very important to highlight, is that these are not FDA regulated, right? So these are supplements that, what that means is anyone can put out a supplement. We don't know the quality of it. So my question then becomes, because obviously we're supporting the idea of supplements, and we talked with Dr. Gio about supporting the idea of testosterone boosting supplements, but what should men be looking for when purchasing a fertility supplement, and how would we know that it's a good supplement that's going to really work for us?
Yeah, it's a really good point. These are not FDA regulated, supplements. Again, going back, they're vitamins and minerals. But there's a few things you can look for, right? There's third-party testing agencies that can test your product and see the consistency from what your label states and what the consumer is actually getting, right? Like NSF International, Consumer Labs, I think they do a great job. So you could look for products that have been third-party tested. There's ways to kind of get that information. I think secondly, consulting with your urologist or your healthcare provider, if you're any supplement you're looking, they may have some information or some sort of brands that they kind of go towards and they think they do a good job. And I think the last point is, again, like supplements aren't meant to replace you getting nutrition from a well-balanced diet, right? Like you can't just ignore a lot of the fruits and vegetables and like take your daily multivitamin and think you're going to be healthier. Yeah, I think this is just, supposed to kind of aid that. And so, prioritizing the kind of daily nutritional balance is also really important.
All right, so let's get into some of these supplements in more detail. I know you talked about L-carnitine earlier. Let's actually talk about CoQ10, which among us male fertility specialists, that's one of the like kind of core, definitely supplements that has pretty robust, good data.
Yeah.
So could you tell us what CoQ10 is? What is it? What does it do, and how does it benefit male fertility?
Yeah, so coenzyme Q10, it's also known as ubiquinone. It's a fat-soluble vitamin-like derivative that plays a role in energy production at the level of the cell, right? Like think back to like the middle school, high school days. You're talking about like cellular energy and ATP. Like that's where
Yeah.
coenzyme Q10 comes in.
Magic school bus.
Yeah. But it also, it's also a powerful antioxidant, and that it plays a role in scavenging free radicals and kind of keeping the reactive oxygen stress levels low with sperm cells and within the testicle. And so it's been studied in a few different trials. And again, these are pretty well done studies, right? These are not like I had 30 patients in my office, I gave them some CoQ10, like what happened, right? These are like
Right.
randomized placebo-controlled trials where they look at changes in hormones, they look at changes in semen parameters, and there was a study in Journal of Urology back in 2002 that showed an improvement in sperm concentration, the movement of sperm, the shape of the sperm. There was a paper in the Fertility and Sterility Journal in 2002, a landmark paper in the Journal of JARG, or Reproductive Genetics, that showed that men who took coenzyme Q10 had a 5-fold increase in their sperm counts, right? You don't see these results with every study, but for the most part, coenzyme Q10 seems to playing a big role. But I think the really most important part is in these studies, CoQ10 is at least 200 to 300 milligrams, right? I think that's really important. Like we don't know what 50 milligrams does. We don't really know what 600 does. And so I think to the consumer, when they're looking for a supplement, like you want to make sure you have at least 200 to 300 to be in that range of where these studies are looking at. If you're looking at a brand that's an amazing seller and great marketing, and you look at their label, right, and there's 50 milligrams of CoQ10, I'd probably think twice about like, where is that data coming from? Like I haven't, you don't really see that studied well. And I think that goes back to the consumer too, right? You got to do your due diligence. You got to just kind of take a deeper dive in some of the ingredients.
I think that's a great point because I think that it's hard for a lot of consumers to understand the dosages of these things. It's honestly hard for a lot of
Yeah.
people, unless you're the ones diving into these studies, to know what the dosages should be. Because you're right. I look at a label and I say, oh, this has CoQ10. And then it says like 25, like it's not doing anything, or maybe it does, but maybe it
Yeah.
doesn't because this isn't the studied amount. So it's a really excellent point where understanding the dosages is just as important as understanding the value of the intervention.
Well, sometimes they do that trick. I feel like on the back of these labels, they do this like percent of daily value, and these are most of the things you don't do, and it just shows like 1,000%. I'm like, oh, this is great. It's packed in here.
Yeah. Something that's really tricky actually is it's even makes it more complicated. A lot of these brands have something called a proprietary blend, right? And so if you think of it at face value, it sounds really legit, right? Like proprietary blend. This is like some real stuff here. Secret sauce. Like we're not going to tell you what it is. And the real fact is getting a proprietary blend is actually pretty easy to do. And I'm actually a big fan of transparency. And so, unless your supplement has a proprietary blend and you've clinically tested it, right? And so there's many supplements for like hair growth and energy, and some of them have been clinically validated. I think that makes sense from like a copyright trademark standpoint. But if you're not like clinically testing your supplement and you have a proprietary blend and the CoQ10 or whatever's in the blend and you have no idea what's in there, I think I'd be cautious of that, right? I think having transparency is actually a better idea. Like, what are you really taking in? You're paying this much, like what's actually in this supplement?
It's a great point. It's a great point. And proprietary always sounds cool as
Yeah.
hell. I mean,
Sounds
I'm
really
not gonna
cool.
lie,
Got to
like
use that in our next episode promotion.
proprietary
Information.
No, it's a great point. So, you mentioned L-carnitine. I don't know if you mentioned zinc. So I wanted you to highlight, zinc and a little bit of L-carnitine too, because it sounds like those two supplements potentially are ones that you think are very important.
Yeah.
Can you tell us about them?
So, I like zinc a lot. It was studied in a paper in FNS back in 2002. And they looked at 103 men who had, trouble with fertility, and they gave them either zinc and a placebo, folic acid and a placebo, zinc and folic acid, and placebo and placebo. So there was four different treatment arms. And again, this was, only trying to highlight the kind of strong evidence-based studies. And in the group that had the combination of zinc and folic acid, these guys had a significant improvement in their total motile sperm count, right? Like something we calculate all the time for patients with semen analysis, how many normal moving sperm, and they saw up to 74% improvement, which is really a high
Wow.
number. And so
Right.
it gave some really strong data for zinc and folic acid. So, and it's a naturally occurring mineral. I think it works well. So I try to integrate that in my patients. L-carnitine, a lot of the data to support it is actually, it seems to be supporting the epididymis, right? The kind of gland behind the testicle. And most of the studies that look at L-carnitine have been done in Italy, and would show an improvement in the motility of sperm. So the movement of sperm can improve up to 10%.
Right.
So, I think from a standpoint of optimizing the quality, the count, the movement, we meet guys who maybe have isolated low movement. There's many other things that can cause that, but I think L-carnitine deficiency may be one of them.
So look, we've had a great conversation so far. Sounds like vitamin A, C, E,
Yeah.
CoQ10, zinc, L-carnitine. These are some good things to look at. Are there, but there's guys out there who are just, taking all the supplements in the world, like everything. So from your perspective, are there any supplements that you think men trying to have a child during their reproductive years need to avoid?
Yeah, it's I think it kind of goes back to what we think about in, right? Like we don't give guys TRT or exogenous testosterone or steroids because that can turn off the testicle production of sperm and testosterone. And so there are a few kind of supplements that may kind of mimic that process, right? Like DHEA, a precursor to testosterone. It hasn't been studied, it hasn't been shown in many studies, but that's potentially a pathway where you're getting a lot of testosterone and the brain may be sensing that like as if it's an exogenous T, and that could potentially be affecting that hypothalamic pituitary gonadal axis. So I typically recommend staying away from DHEA as a precaution, as like an abundance of caution when you're trying to conceive. Similarly, like saw palmetto, it's used, for BPH, used for other things. But I think, lowering levels of DHT that could potentially, disrupt sperm production, ejaculate volume. So again, there's really not many to stay away from, right? I mean, you could take all the supplements you want, probably not going to cause harm to you, I'd say, for the most part. Those are the two that I would say, like, if there's a direct impact on fertility, I'd probably say those two. But on the flip side, right, like, is there too many supplements? Like, is that a risk, right? And we know that's the case too, right? Like, just training in urology, taking too much vitamin C, that can cause kidney stones, right? Too much calcium, that can cause kidney stones. So you want to kind of have the healthy, intake of these things. Too much of some of this stuff can cause secondary issues. So, something to keep in mind.
I totally agree with that. And I actually tell my patients, I go actually one step further. First off, there's really no good data on DHEA at all in testosterone boosting. Conceptually, it makes sense because it's a precursor, but I have not read any literature showing that in any capacity it's ever done anything to boost testosterone. But I tell my patients, I'm like, the best way to improve your testosterone is either through a medication, if you need it, through me, or through lifestyle techniques,
Yeah.
right? Because I have seen issues with non-FDA regulated testosterone boosting supplements where I've had patients come in and they've just done those and their testosterone went from like 200 to like 1,200. And I don't know what the hell's in these things, but I'm assuming that there's something going on, like you said, that to some degree, and these are proprietary blends. I'm not going to say the company's names. I don't want to get in trouble here, but I've seen it happen a handful enough times with people who are not necessarily trying to, preserve their fertility, but I've seen it in guys who are just testosterone boosting, where I'm scared that guys who are trying to improve their fertility are taking these testosterone boosters and they're getting some kind of supplement in there that is potential, or maybe some real deal testosterone or something that's compromising it.
I think that was published, right? I think there was like a study that was published showing that these over-the-counter testosterone boosters were actually carrying some form of testosterone, which again, for patients, that's bad because that can suppress your fertility. And if you're not knowledgeable of that, that can cause you to, be having troubles while you're trying to conceive.
Totally.
Yeah, 100%. So that's where I have gone in the past. I've said, listen, if you want to boost your testosterone, lifestyle, if your testosterone is low and you need something like Clomid or HCG, then we can deal with that. But I'm very, in general, if you're trying to just optimize your testosterone and you're not worried about your fertility, fine. I'm a little bit more lenient. But when it comes to your fertility, I'm telling my patients to kind of stay away from those.
Yeah, I can't agree more. Yeah, totally.
Now we kind of went into some vitamins and minerals, but in general, are there specific things you mentioned? L-carnitine. Are men deficient in general in certain vitamins or minerals that we need to actually be aware of? Maybe in addition to supplementing for our fertility, that we probably need to address.
It's hard to know. I don't really think so. I don't think a lot of guys are deficient in a lot of these vitamins and minerals. Again, I think one of the huge roles of these supplements, it has to do with the reactive oxygen stress and antioxidant properties, right? So like you can not be deficient in any of these, but we've seen plenty of guys who have issues with recurrent miscarriages. They've done a few rounds of IVF, right? They come to see you on their fourth cycle of IVF. You do some advanced sperm testing, which shows elevated levels of DNA fragmentation. And what are the options, right? Like I've seen guys where we go to the testicle and get sperm for IVF, and testicular sperm has been shown, right, to improve IVF outcomes for men with elevated DNA damage. But I've also seen guys who don't want to do that and they want to try a conservative approach. And you can try a conservative approach with antioxidants and supplements that contain antioxidants. That's one of the treatment options, right? And I've had a small sample size. I have an anecdotal experience of a gentleman who didn't want testicular sperm, and he took antioxidants. We repeated the, sperm DNA damage testing, DFI testing, which I've never really done before. I don't know if you guys have any experience of that. And the DFI improved. I mean, it like significantly improved.
Very cool.
Right. So like low risk intervention, maybe it took 3 months of his time. But it saved him a trip to the operating room. It saved him an invasive procedure. Maybe that works. I mean, who's to say it doesn't?
And money. Yeah. Yeah.
Maybe he was jerking off every day too, and it did like a little bit more.
That's another thing, right? I mean, jerking off does help.
It does help in that. So let's, you bring up a good point there, talking about it takes 3 months to, where you kind of said like you start seeing some changes. So let me frame that question and ask you. One thing that's important here is to highlight timing. When a couple's ready to start conceiving. So for men interested in improving their fertility or maybe optimizing it for when that time comes, do you have any recommendations of when they should start taking these supplements?
Yeah, I think it's not to impose stress on couples, right? Like trying to have a baby is so stressful as it is. You got to time ovulation, you got to have sex every day or every other day around the time of ovulation in that fertile window. I think, for couples who I see a lot that, haven't started trying yet and they want to kind of optimize things from the get-go, right? Like we do our basic stuff, like the more important things, right? Like check their hormones, have them do semen testing, make sure everything is okay from a anatomic standpoint. There's no, missing vas deferens and that sort of stuff. Their testosterone levels normalized. And I think for couples who really want to be motivated from the get-go, I think, and they've done that basic evaluation, I think starting supplements from the get-go is fine, right? Like, it's not necessary. You don't have to do it, right? The majority of couples, as we know, achieve a pregnancy naturally in 6 months to a year, right? But I think, if you have the bandwidth and you have the time and you have the resources to purchase some supplements and try to get all hands on deck, I think it's fine to do. You know, and we know that the sperm cycle takes about 72 to 74 days. So, the consistency is key. Like, you can't just take a supplement for like a couple weeks and be like, I'm good to go. My sperm's optimized, right? Like, you got to take it daily, take it for 3 months, take it until you achieve a pregnancy, I think is really the most important step.
Yeah, I think that that's a fair point. And just to highlight that idea of timing again, obviously you said if you're interested and you can afford it, and to start early, but also I just want to highlight for our listeners that a sperm cycle lasts 3 months, right? So it's around 3 months. So usually when we talk about having impacting the sperm or the development of sperm, or how it's impacted by its environment, we're talking about something for 3 months. Now, I don't know the literature on the external, like DFI, how long it takes to impact that, because obviously those sperm are already developed. So I don't know if we have any data, and I welcome you to comment on that, Kian. But when we're talking in general about if we're trying to improve the motility or we're trying to improve the number of sperm, don't expect any supplement, any
Correct.
intervention,
Yeah.
any lifestyle change to impact that change for at least 3 months, because you're going to have a whole new cycle of sperm develop. Now, I don't know if you want to comment about the DFI, because I actually I don't know.
Yeah, it's I'm not really sure either. I think I kind of use the same mantra of 3 months. But that may not necessarily be true, but I think it gives a chance, at least for the antioxidants to take an impact and play a role.
For sure. Um, I did want to bring up one of the studies. You brought up some really excellent studies. There is one study that has been used by a lot of urologists. It's called the MOXIE trial, where they did a randomized study. It's, I think, the largest one that kind of showed the opposite of what a lot of other trials showed, in
Yeah.
that it didn't really impact the fertility outcomes. So I wanted to get your thoughts, get your opinions on that, because obviously, listen, you can do a lot of studies. There's a million studies, and not every study is going to be in agreement. And that's why there's things called systematic reviews. There's, all these other things. But when it comes to the MOXIE trial, it was one of the bigger seminal studies. So I just would like to get your comments on that.
Yeah, I think it was a really well done paper, really well designed study. I think there's a couple things to take away from that paper. They're looking at a very specific list of ingredients and dosages. Number one, and really the take home, message of that paper isn't necessarily about how it changes your sperm counts. It looked at birth rates and pregnancy rates, which is really the end game of all this stuff, anyways, right? Like,
Right.
maybe your sperm counts go up, but did you get pregnant? Did you achieve a pregnancy? And they didn't show any difference from that standpoint. They did show some changes in semen parameters, but it's hard to really kind of take that. Not all the supplements out there have that exact blend, right? Like, how does it apply to my patient? Are they taking that exact
Right.
blend? But I think at the end of the day, right, like, we know supplements are not magical, right? But when you're seeing a guy and a couple in the office who have literally tried everything, um, who've literally tried everything, and they're like, Doc, anything else I could do, right? Like, their testosterone's normal, there's nothing anatomic. They just have low sperm counts. You've done genetic testing, right? Like, getting this guy on supplements is, couples want to feel like they've tried everything, right? And if there's a paper that says it doesn't work, well, like, I mean, if the guy wants to try it's a very, low risk intervention, I think. And I think the satisfaction that it could bring a couple is so high that it really outweighs maybe it doesn't work. Maybe it works a little bit. Like who you know what I'm saying? Like, I think that's where you're kind of basing it against.
That's a fantastic point. Just to kind of just segue for a second. For those who are listening, Keon's light went down, and I want to say for a second, I thought it was like you turned into a vampire.
Yeah, it was spooky as fuck, dude.
Halloween.
Halloween's coming around, but no,
that's why you don't watch the YouTube. That was funny as shit.
But to go back to that point, to the point that you made, and I think it's fantastic, and I think we all can probably agree on this as male fertility specialists. Like, we don't know everything about male fertility, and I think we'll be very transparent on that. If we knew that, we would know how to improve your sperm parameters when your DNA frag is down, and we would have much more better conception rates. But we don't, and I'm really transparent to my patients about that, saying like, hey, look, like, maybe this supplement is treating something that we currently don't measure, and this could be it. And I'll say it, we don't know everything. These studies may not cover everything, and so that's kind of my approach. And the risk is rather low, and I love that point you made. The risk for the most part is rather low.
Yeah,
and so
I want to piggyback off of both of your sentiments. I think when I counsel my patients on supplements, I give them a list of supplements, pretty much the ones that, Kian had mentioned. And I say, listen, some data supports it, some data doesn't. At the end of the day, the risk is very low. The biggest risk is to your wallet, right? Because you have to pay for the pills, or the supplements. But other than that, the risk is relatively low, and if you're willing to, pay for a supplement and you want to take the chance, I think that it's totally, totally worth it. And the other thing is this, right? One thing that we've started to learn, I'd say in the literature in the last 3 to 5 years, is that people come in and they have good sperm counts and we don't know why they're not achieving pregnancies, but we also are learning that more sperm is actually better, right? So even these guys who come in with normal sperm counts and they're like, and they have normal testosterone and they're like, how can I do better? I think a supplement is actually a very reasonable option, right? Because if you're talking about doing better, sorry, he went vampire again, I apologize. So if we're talking about someone who has normal testosterone, is a healthy person, has great sperm count, we know that improving your sperm count, there's like no threshold. It just continues to improve your fertility outcomes. So, I think that this is another way of looking at that for giving people the opportunity to even improve what's already good.
Yeah. Yeah.
So, Kian, any final thoughts, comments on male fertility supplements?
I think we, hit on a lot of these. I think, the main takeaways are educating the consumers on what do the supplements do, right? There's like some broad strokes, right? So keeping DNA damage levels low, we know is important, right? If you're deficient in some of these things, it can help with sperm production and help with the motility of sperm. Some supplements, have been shown to improve ejaculate volume, right? Some can potentially improve testosterone. I think the take-home point is, as a consumer, do your due diligence in terms of looking at the brand, like who made the supplement. There's so many things that go into it, marketing, branding, all that sort of stuff. Check with your healthcare provider and see if there's something that they can also clue you into. There's third-party testing for a lot of these ingredients, right, that they're not FDA regulated. But, again, I think that the take home for me is, I give it as an option to patients. I don't say like, you need to take this, like this is really going to help you. But I think guys want to try everything they can. And I think it's something that can really, move the needle for some folks.
So on that note about fertility supplements, Kian, why don't you tell us about your fertility product, Love and Live?
I'd love to. So, thanks, Justin. In fellowship, I met a lot of guys in the office, and as a part of our protocol, we'd recommend supplements, and we recommended a few different supplements that purchase over the counter or on Amazon. And there was a lot of guys that asked me, like, my chart message me on Epic or whatever EMR and be like, hey, I found this brand, or what brand do you recommend? I don't really want to take 3-4 different supplements that you're telling me to take. And so I kind of took a deeper dive in some of this stuff, and I looked at the brands and looked what was out there. And something that just came across was that I couldn't find really any male fertility doctors making male fertility supplements, right? It was a lot of female fertility doctors who do a really excellent job, I think, on the female side of things, and maybe they have a male supplement too. And when patients ask me like, "Oh, I purchased this brand. What do you think?" I would say, it looks okay, but they're missing a few key ingredients that I tell patients to take. And so that's kind of what really started the process over the past year. I kind of looked into making my own supplement that integrated the things that I thought was most helpful, right? And so having taken a deeper dive in some of this literature, saw some of the stuff that like was in these supplements that I'm like, there's really no data to support this, or like that supplement only has X amount, but the studies show this. So I try to fine tune it and find a balance. And that's when I created this supplement, Lev and Live. And so, my kids' names are Olivia and Lev. And so I kind of named it after them because they're, the two most important people in my life in addition to my wife. And named the supplement itself Fertile Force. And so, just kind of launched it recently as something as another option to guys.
I just saw it has probiotics in it.
That's something in there that I integrated that I thought was really key, and that's integrating the probiotics because of some of the new data out there that looks at the gut health. And so it's kind of an emerging treatment option, and there's been a few studies looking at it, but that's something that hasn't really been seen on the market.
Very cool, man. I mean, listen, obviously our listeners have a good understanding about you, about your knowledge in the space. You're a freaking urologist in fertility at USC, man. I mean, come on, pretty impressive stuff. And obviously you know us, which makes you even cooler, but
yeah. I agree.
But it's a great product, and obviously you're really knowledgeable, you're really passionate about this, so we want to thank you for coming on. Can you tell our listeners where they can find you, where they can find Lev and Live, the product itself?
Yeah, so it's sold on our website. It's called levandlive.co or levandlive.com. Both will take you there. You could see it there. And I work at USC. I'm at Keck Medicine. I have offices in Beverly Hills and Santa Clarita. Love to meet you and take care of you if you're struggling with fertility or want to kind of check your fertility. And that's about me.
All right. Well, as always, thanks to everyone listening. This was a great episode. Kian, we'll see you. I don't know if this will probably come out by the time I see you, but we'll see you in a couple weeks for one of our conferences. It'll be really fun to hang out and catch up in person.
Awesome, guys. It's been an absolute pleasure. Thanks for having me on the show. It means a lot, and I'm glad we were able to catch up about this.
Awesome, man. Thanks to our listeners. As always, check out our podcast, The Man Up Pod. Subscribe on YouTube so that you can actually see Kian become a vampire.
That was awesome.
That was hysterical. And always subscribe, comment as well. And Spotify, iTunes, and all of our socials at The Man Up Pod. For Kevin and Kian, thanks for listening. Have a good one.